Welcome to Orthopedic and Spine Center's Open MRI Center. Over the next few minutes, this video will prepare you for your MRI experience. An MRI, or magnetic resonance imaging, produces images of your bones, tissue, and organs, providing non-invasive diagnostic information for your doctor. The Hitachi Oasis with 1.2 Tesla magnets is built to accommodate most children, larger patients, and those with claustrophobia or who are anxious. When you arrive for your MRI, use the second entrance on the far side of the building to enter the Open MRI Center. Plan to arrive 15 minutes before your appointment time to complete your paperwork and pre-MRI checks. If you have not arrived by your appointment time, your scan will be canceled. You may reschedule your appointment with the front desk or by phone. The door is locked for safety on weekends and before and after regular business hours on weekdays. If the door is locked when you arrive for your appointment, you may need to press the button to the left of the door for entry. Please allow a moment to buzz you in, as the technologist may be with the patient. Please bring your government-issued photo identification and your insurance card to your appointment. Dress in easily removable clothing. You will be required to change into a provided gown and shorts during the scan for your safety. If you are claustrophobic, please discuss this with your physician when scheduling your appointment. If the physician who ordered your MRI prescribed a sedative, take the sedative as prescribed before your appointment time to allow it to begin before you enter the MRI machine. For your safety, if you choose to take a sedative, you will need to arrange for someone to drive you home. If a driver is not present with you at check-in, your appointment will be rescheduled. If you are having an MRI with contrast and are over the age of 60, have high blood pressure or diabetes, you will have your kidney function tested on site prior to your MRI. If you are having abdominal studies, you should not eat or drink for 4 hours prior to your appointment. This helps to cut down on bowel motion during the test and your gallbladder to stay full, so that it's visible during the images. It's imperative that you notify us of any allergies to iodine, shellfish, or imaging dye, and if you have any metallic objects or fragments in your body, both foreign and surgical. You may not be able to have an MRI if you have a pacemaker, non-removable hearing aid, brain aneurysm clip, internal medication pump, electrical stimulator, or neurostimulator. There is a potential risk that the object could malfunction, overheat, or change position, possibly causing injury or death. Your technologist may go over these questions with you more than once to ensure your safety. If any of these apply to you, please discuss this with a member of our MRI staff now. A friendly OSC staff member will direct you to the dressing rooms, where you will change into a provided examination gown and shorts. All clothing, hairpins, wigs, and jewelry, including dermal piercings, must be removed. Certain fabrics, thread, jewelry, and other items have the potential to overheat or move and cause serious injury or death. You will be provided a locker for your personal belongings. OSC is not responsible for any lost or stolen items. We recommend leaving valuables at home. When you finish changing, place all of your personal belongings inside the locker. You will not be able to take anything in the MRI room with you. Should you need a wheelchair, cane, or other assistive device, an MRI safe one will be provided to you. Outside devices are not allowed in the MRI room. Now is a great time to use the restroom if you need, as your MRI may last 30 to 45 minutes without a break. When you have finished, have a seat and wait for your technologist to escort you into the MRI room. We will assist you onto the table, outfit you with the appropriate coil, and position you between the two magnets. Your head will be under the magnet unless we are scanning your foot or ankle. If you are chilly, our team may provide you a blanket prior to the start of the scan. During your MRI, it is imperative that you remain still, as movement makes the images blurry. The initial scan, called scout images, allows the technologist to set up the remaining scans. Since all future scans will be based off of the scout images, your images will be anatomically incorrect if there's any movement. How you're positioned on the table depends on the type of scan you need. Your technologist will position you in the appropriate direction with the appropriate coil, how they can get the best possible images while keeping you as comfortable as possible. Unless the scan is of your foot or ankle, your full body will be between the two magnets for the duration of the scan. If you find you are unable to enter the MRI machine, please communicate your concerns with our staff. Those with an altered mental state, such as dementia, are allowed to have someone accompany them into the MRI room. For their safety, the person accompanying the patient must follow the same procedures as the patient, wearing the provided gown and shorts, and remove all other clothing and jewelry, as well as inform us of any metallic objects or fragments in their body. For your safety, there are no exceptions. You will hear the machine making knocking sounds or feel vibrations. This is normal. Headphones with music are available for your comfort. Should you need to communicate with us at any time during the MRI scan, simply press the button the MRI staff handed you at the beginning of the scan. A member of our team is on the other side of a glass panel and can see and hear you. When the MRI is complete, we will enter the room and move the table out from between the magnets. Please wait for the table to be lowered before sitting up. Sit up slowly and wait a moment before standing, as this will help you be more steady on your feet. If you need assistance, please let your technologist know. After you have collected your belongings from the locker, you may place the gown in the hamper, the provided shorts in the trash, and redress in the dressing room. After your MRI, our radiologist reviews the images and sends a report to the doctor who ordered your MRI. Schedule a follow-up appointment with your doctor to discuss the results. Thank you for choosing OSC's Open MRI Center, where you can experience excellence.